Hydration. Why drinking enough water is necessary. Interview. Dr. Vincent Estrade, urologist at Angoulême Hospital and Bordeaux University Hospital, recalls the fundamentals of hydration, particularly in the event of bladder problems or urinary stone. FIGAR. It's a trivial question, but can you remember what it's for drinking? D. Vincent Estrade. Water is a neutral element that cleanses the body. Drinking has the effect of diluting the urine, reducing the concentration of the various components found there. Regular, abundant hydration, at least 1.5 liters per day, is essential, especially in the event of bladder problem. And of course, for people with stones in the urinary tract, which is my specialty. Because the first cause of these urinary stones is insufficient hydration. For lack of drinking enough, oxalate and calcium concentrate in the urine and, above a certain threshold, crystallize and form stone. The risk of recurrence is further increased in the event of poor hydration, as well as the occurrence of urinary tract infection. This pathology, which, according to some studies, concerns 15% of the population, is becoming more and more frequent in France and in other developed countries. It is the result of a diet that is too rich in sugar, salt, fats and animal protein. Also beware of seeds rich in oxalic acid, walnuts, hazelnuts and other almonds, which are well known for good nutrition. Are we drinking enough? Not real. In France, there is a loss of the reflex to get enough hydration when you need it. As for my patients, sometimes you literally have to force them. As part of their pathologies, they must drink enough water to urinate 2 liters a day, but they are not trained to drink. In some cases, being sent to a spa can be beneficial to the. In France, 2 centers are recognized for lithiasis disease, Vittel and Capver. These cures add to the message of the urologist and teach patients to hydrate properly during the cure. A sort of training in drinking, to be adopted afterwards, over the long term, in their daily life. Which water to choose? No matter. Either that or the tap, perfectly adapted for these so-called lithiasis diseases. Either spring water or mineral weight. They should not be too salty. Salt prevents the kidney from doing its job properly. For patients who like to drink sparkling water, we recommend carbonated spring water with CO2 without added salt. Note that when there is bicarbonate in the water, there is often also salt. But calcium is welcome, 80 to 120 milligrams per litre. This element present in the waters is vital because it is essential for the proper functioning of the body, for example, in the contraction of muscle cells, breathing, the heart, etc. Drinking calcium while finishing your glass of water is all the more useful since many patients do not eat enough dairy products, and therefore absorb little of this mineral salt. Yet urine and X27, T stones calcium? This is an erroneous belief that dies hard. Some doctors have claimed in the past that when you have urinary stones, you should decrease the calcium intake from the weight. The general public often believes it too. But this is a faulty interpretation around the words in quat, calculus and quat, and in quat, calcium and quat. The etymology of calculus, urinary, is the Latin calculus, which corresponded to pebble. Nothing to do with calcium. Any last tips for staying hydrated? You have to drink throughout the day, and remember to drink a good glass of water before going to bed to stay hydrated for the night. Because while we sleep, the urine continues to concentrate, and the large glass of water inhibits this effect.